Okay, good. I've got 12:01. We'll go ahead and get started. I just want to welcome everybody to today's presentation of the Transportation Equity Task Force. I'm Lisa Stedman, a participant of the task force. So this meeting is being recorded, and we're going to share the recording in the future with others on our website. The reason the audience is muted and you're not able to turn on cameras is because we're trying to create a webinar style experience for you. But toward the end, we'll start to relax those criteria, and you may be able to turn on your cameras when we get into open discussion. If you need anything throughout the meeting, go ahead and use the chat box, or you can raise your hand to be recognized. Advocates Building Lasting Equality in New Hampshire, or ABLE New Hampshire as we know it, advocates for civil and human rights of children and adults with disabilities. We promote full participation by improving systems, connecting families, inspiring communities, and influencing public policy. ABLE has lots of task forces and initiatives, and every year our participants and members tell us which task forces are most important to them. In 2024, we formed the Transportation Equity Task Force. And so this is one of our primary initiatives, the Lunch and Learn series. We're doing this to help people with disabilities become aware of the many transportation options and resources that are out there, and to help them become comfortable using the tools to get to where they need to go. Next month, we're going to talk about assistive technology for transportation applications. And on February 20th, we're going to talk about regional coordinating councils and how you can be a part of that local mastermind group. In the past, we've done lunch and learns on several topics. And if you want to go back to our archive, you can find that on the ABLE New Hampshire website. It's very easy to navigate to that by going to Transportation Equity Task Force and scrolling to Lunch and Learn series. There's also going to be a link in the follow-up email that we send after this presentation. So today we're here to talk about Uber Caregiver. Everyone's very interested in how Uber can help us to meet our transportation goals. And our speakers are going to be Jasmine Bowen and Patrick Mulville from Uber Health. And also Lindsay McGee is here from BDS to help reinforce how Uber can be integrated with waiver benefits if you're on Medicaid. So I'm going to go ahead and turn it over to Jasmine right now.
Great. Thank you so much, Lisa. And thank you everyone for joining the call today. I am so excited to present to this group and have Patrick with me here as well from Uber Health. And we are a team within Uber who is developing products that are supporting individuals get to not only health or medical appointments, but use Uber to get to places that you want to go in the community, whether that means going to work in the morning and coming back home in the evening, or going to the grocery store to pick up groceries, or meeting up with a friend for coffee. And so we're really excited about the possibility for Uber to be another tool in your toolbox when you're thinking about ways to get where you need to go. I have been at Uber for just over a year now, and before working at Uber, I worked in the state of Wisconsin in home and community-based services. So it's exciting to be able to bring Uber into this kind of discussion and to be part of this also with Lindsay to talk about how we can make Uber part of waiver covered services as well. Patrick, do you want to do a quick intro as well?
Yes, I'm Patrick Mulvihill, and I work directly with a lot of agencies and organizations to either set up Uber Health within that agency or support different programs that are focused on transportation. So I'm excited to be here with you all today and looking forward to a lot of questions and Jasmine's presentation. Thanks.
Awesome. All right, we'll get started here. A little bit of background on Uber Health. Some folks don't realize it. Uber Health has been around for quite a bit now. We started in 2018, and one of the unique things about Uber Health is having a HIPAA-enabled platform. And so we've been able to partner with more than half of state Medicaid programs so that if someone is on Medicaid and is using their non-emergency medical transportation benefit, Uber can be one of those covered options that's paid for by Medicaid. And so while a lot of our work has been on that medical side, what we're here to talk to you about today is community transportation and really thinking about the non-medical transportation rides that are promoting, your ability to access the community. So bringing us into today, one of the things that we're going to talk about is basically the ability for a consumer to book a ride on the Uber app, but have that ride be billed to your service coordination agency or your provider or your AAA. And so this is something that we hope is going to really expand the ability for folks to get where they need to go. These are some of the partnerships that we already have in New Hampshire. So we already work with a lot of behavioral health providers, health systems, hospitals, and some of the organizations that actually Patrick is working with right now. I had wrote down Gateways Community Services and the Moore Center as some of the provider organizations in the HCBS space who have already signaled being interested in Uber. And so Patrick is working with them on how can we make Uber Health available to individuals who are being served by those providers. And we hope that that will grow. So we're going to talk about two different paths today. We're going to talk about self-pay and waiver pay. So when I'm saying self-pay, I basically am just saying this is a ride through Uber that can be paid by either a rider's credit card or debit card, or a caregiver can book a ride on behalf of a rider using their own funding mechanism. So I'm going to walk you through what that looks like. If you're a caregiver on the call who wants to book an Uber ride for someone in your family or an individual that you're supporting, how you can do that now, today. And then on the right-hand side, we're going to talk a little bit about how your waiver funds could pay for your Uber trips. All right, so we're going to start off here. I'm going to show you a little demo of how you can book rides for family members or for another individual. And I use this function a lot today. Sometimes I'm booking a ride for my mom, sometimes for a friend or someone that I'm trying to look out for. And so I'm going to take you through this demo. And I'm going to show you some screenshots. This is, as if you were looking at my phone, but I'll show you just how kind of easy it is to do this. So when you open the Uber app, you're going to see your home page. If you go to your account button, which is on the bottom right-hand side of your app, you're going to click account. And then if you scroll down, by the way, I'm proud of my 4.92 star rating. I feel like that's pretty good, right, y'all? That's pretty good. I'm staying in the good graces of the Uber drivers. But if you scroll down here in your account options, you'll see an option for family. And it says manage teen, adult, and senior accounts. So if you tap family, what you're able to do is you're able to add people into your family profile. So you can see on my app under members, I have a couple of people who I have within my family circle here. I have Noah and Emery. And then if you look at the very bottom, you'll see the payment method. And so this is where you as a caregiver or a family member will add in whatever payment method you want to use to book a ride for an individual. And so we're going to add a new family member here. So you click that add new member, and then you see a couple of options. And so if you choose teen, adult, or senior, it's going to give you some, the same Uber app, but with some enhancements. So as an example, if you choose the senior option, this is automatically going to give the individual the ability to turn on the simple mode version of the app, which is something that might be desired across the wider group of seniors that might benefit from having a larger font and a little bit more of a simplified experience. But in this example, I'm going to choose adult. So I'm going to show you this demo as if I was adding my dad. So we'll choose adult, and then I'm going to see kind of a welcome screen here saying, invite adults to your family profile. You can pay for rides and orders. You can set spending limits, and you can follow rides. Yes, that is what I want to do. So I'm going to click choose a contact. And then here's where I would put in my dad's information: first name, last name, his phone number. And the phone number is important because whoever you're setting up as the individual that you're going to book rides for is going to get messages to their phone, updating them on, so-and-so, your caregiver or family member has booked a ride for you, and it's going to give them information about their Uber driver and their Uber vehicle. So now when I go to book an Uber in the app, you'll see here you have the ability to put in your ride destination, but you'll also see where it says for me, this is who you're booking the ride for, and you can change that now. So if you click on for me, you're going to be able to see all the people in your circle. And so in this example, I'm going to switch it to dad. I'm going to click done. And now you see dad is listed as a person that this trip is for. And that's basically all there is to it in terms of the setup. So now, if I'm booking a ride for my dad, I am going to be able to put in his destination. I'm going to be able to pick my Uber. He is also going to get a text message to his phone, and he's going to be able to get information about the Uber driver that's coming his way. And so now I'm going to talk a little bit about what if, it's obviously great if you're able to book a ride for someone else, but also recognizing there might be folks on the call today who are in a waiver. And so maybe you're thinking, how can I have my waiver pay for my Uber trips? And this is where we introduce one of our newest features, which is called Uber Health Self-Booking. It's essentially the very similar experience to what you might experience if you were booking an Uber ride right now, except that your provider, so again, this could be your service coordination agency, or another service provider, or maybe it's a day services provider, for example, that provider is going to be able to pay for your Uber. And so the way that we work with this feature is we partner with each of those providers and allow them to invite individuals to do this. So I'm going to show you what self-booking looks like now. These are kind of the 3 high-level steps. So like I mentioned, how this works, and this is kind of where Patrick comes in, is he works with an organization to set up the Uber Health dashboard. And that provider is able to then onboard folks to the ride benefit. So in the middle of the screen here, you'll see some screens of what the rider is going to see on their smartphone. So they'll get an invitation in the app. And then finally, rider is going to be able to book their Uber through the app. But that ride is going to go back and be billed to your provider organization. So zooming in a little bit more here, what it would look like for a rider who is booking a ride that's billed to their provider. Same thing, they're going to put in their destination in the app. You're going to choose your Uber trip. But one difference here is in the bottom where you see the payment method, you're going to choose the payment method that is your provider. So in this example, we're just calling the provider ABC Health, but this would be replaced with the name of your provider and their logo. And this is what's going to tell you you're booking an Uber trip and it's going to be charged to your provider. One thing that is a helpful tool also with this platform is As a rider, you are able to track how many rides or dollars left you have within your benefit. So maybe your provider has said, you're approved for 24 rides, or you have a budget of $1,000 for trips through Uber. You are able to see in the app how much you have left. And so if you notice that you're getting close to your maximum number of rides or you're running out of rides, you can then talk to your service coordinator and see if you can be authorized for more. And then another thing I just want to highlight as well. So what I just showed you is great for an individual who has a smartphone and can book rides within the Uber app. But if someone does need more support booking a ride, we also have a coordinator booking option. And this would let someone at the provider agency, so maybe this is a care coordination manager or a transportation manager, they can enter in your pickup address and drop off address, and they'll be able to book that ride for a rider. And that could be for right now, or it could be for a certain time in the future. And this gives another option for folks who might want someone to support them with booking their ride. And I also want to show you a couple of features that are going to be relevant for folks with disabilities and older adults as well. One of the things that I always say I'm really excited about with working at Uber Health is we have a product team that is really interested in how to make Uber more accessible for folks with disabilities and older adults. And so one of the features that is going to be coming out next year is called Pickup Assistant. And this is going to be a feature that lets you as a rider tell your driver certain information that you think it's important for them to know. So as an example, if you're someone who's sensitive to loud sounds, you might want to tell your driver that, like, hey, please don't play music. Or you could say something like, prefer not to have conversation during this ride. And so we're really interested in ways that we can facilitate sharing some of that information so that drivers have a little bit more empathy when they're picking up a rider and a little bit more understanding of who they're picking up. And overall, just, helping to make it a more pleasant experience for any rider. Another really exciting feature that's all rolled out, and I've recently tested this out myself. Women riders can now choose to match with women drivers. And so that might be something that adds another level of comfort, maybe especially when you're thinking about rides in the evening or late at night. And then an additional preference that is being developed is for seat height. So if you know that you would benefit from having a vehicle with a lower seat, you'd be able to indicate that as a preference so that the Uber that you get has the seat height that is more accommodating. And then another exciting development is called simple mode. And simple mode is something that can be toggled in your app to give you a simpler version of the app. So you can see what the app looks like on the left-hand side right now as a standard Uber app. And then on the right side, you see there's just a lot less visually to digest. You can see your shortcuts here. So you could put in your healthcare provider as an example. We've got daughter's house here and grocery store, if those are your frequent destinations. And so that gives you fewer clicks basically to navigate through the app. And again, I'll give you a little demo on where to find that simple mode option. So if you are starting on the home screen of the Uber app and then you go to the account section of the app on the right-hand side, you're going to see simple mode as an option. And right now it says a simplified app for older adults. I use simple mode and I'm 30. So if I am considered an older adult, I'll take it. I think we can all appreciate simplicity being valuable for everyone. But yeah, simple mode is really for anyone who is wanting to use an app that's a little bit more easily digestible. But when you click on simple mode, you're going to be able to turn on this button that says turn on a simplified version of the app. And then when you do that, you can choose text size as well. So if you toggle from standard to large, you're going to get larger text throughout the app, which hopefully is helpful for some folks. I know for my mom, that'd be a valuable one. Another thing to call out as well. So our team did a user experience research study earlier this year on simple mode and on self-booking. And with some of the individuals who were included in that, they did have vision challenges. And so we did see some folks using screen readers and other tools to navigate the Uber app. And so those are also tools that can be used with Uber to make it accessible to you. Alrighty, and now I'm going to move into safety requirements too. I know this is something that is really important about maybe using Uber for the first time and wondering about who your driver is going to be. So I'm going to level set on some information about that now. So all of our Uber drivers have an annual background check, and that is both a criminal history check and a driving history check. And so if anyone has any qualifying negative record in those checks, they would not be able to drive for Uber. And we also have a system that will tell us in between those annual checks if there are any changes in those records. And so one of the things that we also do is if a driver's not allowed to participate in other federal programs or state programs, they would be excluded as well. One thing that makes Uber Health slightly elevated compared to the regular Uber app is we do have a pool of drivers for Uber Health that have slightly more elevated requirements. So drivers have to have sufficient account history to be Uber Health drivers, and they have to have no record of interpersonal issues with riders in the past. And so this is another way that we make sure that the drivers that are assigned to take trips specifically for the audience of folks who are doing medical trips or folks with disabilities and older adults are the highest quality of drivers. And the good news is that most Uber drivers do fit into this higher level criteria. Another thing to call out that adds some peace of mind is when someone is taking an Uber trip, they're also able to add on up to 3 trusted contacts to be able to watch a trip while it is in motion. So you could add in, for example, a brother, you could add in a care manager, or you could add someone else so that they can see exactly where you are as you're making your way to your destination. And then those folks also, if needed, are able to communicate with the driver as well. And another layer on top of this too is our Uber Health product offers a dedicated support line. So where we're working with providers in the HCBS space, if there is any issue at all, there's a dedicated team that specifically is working with kind of your healthcare and community services providers. And then maybe a question that a lot of you are wondering too is Uber even available in my area? And so what I've pulled for you is a map that shows what this looks like across the state of New Hampshire. So this map is showing in darkest green the area where there's great driver availability. So meaning you should be able to match with a driver within 10 to 15 minutes. And then you'll see some other shades of green that are a little bit lighter. And these lighter shade basically mean that you can match with an Uber driver, but it might take longer to make that connection. And so you might have more of a challenge, especially during different times of the day in matching with a driver. So I've listed out here some of the areas where Uber driver availability is the strongest, but we definitely recognize too that Uber is not everywhere yet. And so one of the things that I think about in terms of making Uber more available to more of the state is, knowing that there are a lot of family members and caregivers right now who are driving their loved ones around. What if those caregivers become Uber drivers? And while they're doing a trip for their own family member, maybe they do a trip for their neighbor too. Maybe they do more trips for their whole community. And so maybe there's an opportunity for there to be more Uber drivers in an area to support more people who want to use Uber. One of the things that's coming up in 2026 and 2027 is the new Medicaid work requirements. And so maybe some folks who are trying to meet those work requirements are going to think of Uber as a way to check that box and meet that employment requirement. And so I'm hopeful that maybe this will be another opportunity to see an increase in drivers who are able to really expand the availability of Uber throughout the state. And that is the end of my presentation. So I'm gonna stop sharing my screen here. I'm gonna take a look at who we have on the call, and I'm gonna take a look at our questions. But I think before we go into Q&A, I'm gonna pass it over to Lindsay to talk a little bit about the BDS side.
Thanks, Jasmine. So hi, for those of you who don't know me, I'm Lindsay McGee. I'm the waiver administrator with the Bureau of Developmental Services. So I work with 3 of our 1915C home and community-based care waivers. So some of you may be familiar or may be utilizing the acquired brain disorder waiver and the developmental disabilities waiver. We also have our in-home supports waiver for children. I think this is a really exciting opportunity for people to be able to utilize non-medical transportation as a waiver service more independently. I know we've heard some challenges with, service coordinators potentially needing to book rides. And I think this is just going to open up a lot of freedom for individuals. So if you don't currently have non-medical transportation services, but you're interested in it, please contact your service coordinator and they can help put that request in, put it in your service agreement, so you can start accessing that and we can go from there.
Awesome. Lisa, did you have anything to add here before we go into questions?
So we are going to go to questions, but I'm going to start sharing my own screen here so that everyone can see the QR code for the closing survey. You are welcome to do the closing survey while we're going through questions. It's helpful for us to have you do this closing survey because with your email address, that's the only way we're going to be able to follow up with you and send you the recording of this presentation and also have you on our lists for future presentations. Let's start looking at some questions in the chat box. And I see one from Suzanne first. Do you spot that one, Jasmine?
Yes, I'm looking at that question. So the question is if someone receiving Medicaid needed a ride to their day program, would they still have to set it up with CTS or MTM in order for Medicaid to pay? So my understanding, right, CTS and MTM are the NEMT brokers. But Lindsay, maybe I'll let you hop in here because I think this could be not necessarily a medical trip and under HCBS.
Yep, I can grab this one. So typically CTS or MTM are providing not our they're providing medical transportation for medical visits. I'm going to get the acronym wrong. But Uber can be providing non-medical transportation as a waiver service. So that would, if you're accessing it under the waiver. So we would have that waiver service in a service agreement so that it could be billed for that way. And then the second part of that question is related to having the same Uber driver transport individuals to and from an adult day program to ensure consistency. And I'll let you grab that
Yeah,
one, Jess.
we'll do a trade. We'll do a trade. Yeah. This is a great question, and it's one that I have heard a few times. At this point in time, though, no, we don't have a way for an individual to, select a certain driver to be their repeating driver. But I have heard this need a few times that there are folks who prefer to ride with someone that they know and are comfortable with each time they need to go somewhere. So it's something that I can bring back to our team as something to consider. But yeah, not at this time.
All right, so I'll throw one in there. What if I am such a beginner that I don't even know how to download the Uber app? Where would I go for hand-over-hand help just getting started with this whole thing?
Yeah, absolutely. So if you have an iPhone, I think you're going to the App Store. I have an Android phone, so that's the Google Play Store. But if you go into your App Store and you search Uber, Uber will pop up. And so you can download the app from there, and then when you open it, you'll be able to see the screens that I was showing you today.
And I
All right.
think service coordination too can help walk through that.
So what if my area agency isn't set up with Uber yet? Is there anything I can do to help encourage that?
Absolutely. I would encourage them to reach out to the liaison, or you could reach out to your BDS liaison directly. We really want to get provider agencies and area agencies involved in this way of being able to provide non-medical transportation. So any kind of nudges or advocacy that people can do would be wonderful.
Oh, no.
I saw a question about, are the drivers trained in sensitivity
Oh,
to specific needs of the riders?
Yeah, so we don't have any specific training for drivers around dementia or, specific mental illnesses. One of the things that we are trying to do to mitigate that is that pickup assistance feature, which will, at least give the driver some context for the individual that they're transporting, and also if there's helpful or useful information to support an individual to make the experience smoother. So, by saying, hey, I've got a cane or a walker, it might take me another extra few minutes. That's something that the driver can be more accommodating with if they know about that in advance. Another thing too is if someone hasn't used Uber before and they're trying to figure out if it's a good option for them, they can bring someone with them on the ride at no additional cost for the ride. And so if you're someone who's supporting an individual with transportation, you could do a ride with an individual and see how it goes. And there's no additional charge for that.
I got a
That
question.
helps.
Go
Yeah,
ahead,
sure.
Rosie.
I have appointments at Dartmouth, and if the bus can't pick me up, how much does Uber cost?
That's a really good question too. So generally, I think the average Uber cost is like $23 to $25 just across any distance and length of trip. But the pricing for an Uber is dynamic, meaning the cost for the trip might change a little bit depending on the time of the day that you're booking the ride. And what there's a lot of factors that go into that pricing, but generally you can expect it to be around that 20 to $25 range.
And another thing, I was just wondering if do you think my Medicaid or my Medicare could be on it?
We are working on being available through New Hampshire's Medicaid program. So not yet, but at some point in the future, we would love to have the where if you're calling, MTM or CTS and you say, hey, like I want to use Uber, they can make sure that you get a covered Uber through your Medicaid NEMT program. But let me pause there too. Do you have anything to add to that, Lindsay?
No, I think that makes sense. And if you are on a waiver, this is something definitely to talk to your service coordinator about.
Oh, and another thing, can I have the pamphlet on that, please?
Yeah, we'll make sure that you get that in the aftermath, Roseanne. Thank you for asking. Lindsay, while you're on the spot, I just want to ask you, if somebody prepays for a trip, can they be reimbursed out of waiver funds?
They can. So it's not the preferred way to do the service, but that is allowable. Yes.
Right. Kelly, you're up.
Okay, I was wondering, is this for non-medical transportation at this point? I'm confused. For Uber, you're calling it Uber Health, but Health sounds like I'm going to the doctor because I have strep throat or something like that. Is this non-medical right now?
Yes. Yep. It can be used for
Okay,
non-medical. It could also be paid for privately, but we definitely wanted to talk about using it for non-medical transportation and the waiver services.
right. Because I would say that I've gone on medical trips and I've paid up to $60 and it was Lyft. So it's very expensive because I went all the way from Nashua to Dover. So I wouldn't say it's $30. I'd say it could be up to $60. I've gone from my apartment to Concord and it's 60 each way because I've testified on bills. And Gateways is one of the agencies that's working on it, so I'll interrogate my service coordinator. I'm with Gateways.
Oh,
So
great.
thank you for that.
Yeah, thank you, Kelly. And that's totally valid that you're seeing those larger trip costs, especially if you're going long distances. So yeah, I mean, take that 20 to 25 with a grain of salt. I think that would be an average for kind of a shorter distance trip, but definitely it can be more expensive if you're going a long way.
All right, Ben, go ahead. It's your turn.
Thank you. I was wondering, so are trips that are booked under Uber Health still susceptible to like surge pricing that you'll see under like a traditional Uber service?
Yep, it works the same. So the pricing for a trip that you're getting, for non-medical transportation through Uber Health, it's same pricing as you would generally expect from a regular Uber. Um, but yeah,
And
Patrick, do you have any notes on that kind of surge pricing piece?
Yeah, great question, Ben. I think, from a surge pricing perspective, where we typically see a lot of surge pricing is around large sporting events or New Year's and things of that nature. So, as a overall kind of ride program, we typically don't see those surges, right? So for like rides where, as Kelly had mentioned, for that trip from to and from Dover, being $60, she might see that be something that could fluctuate, $5 more, $5 less type thing. But those you wouldn't see a surge unless those specific events are going to be happening. And so a lot of our dynamic pricing is purely based on supply and demand when it comes to booking those trips.
Do I still tip my driver?
So for the Uber Health program, there is a way for you to tip the driver after the trip has taken place as a coordinator. But Jasmine, I don't know if you have any more details as far as through the like self-booking process for agencies
Yeah,
and things. Yeah.
yep. Yeah, so for self-booking, like thinking about providers, right, who are providing waiver services, we know that Medicaid won't pay for tips. Medicaid will only pay for the cost of the service itself. And so for self-booking, actually tipping is not enabled. So if you're booking a ride through your waiver funding, you don't have the option to tip. And sometimes people are worried about that. And they're like, okay, well, if I don't tip, does that mean the driver is going to give me a bad star rating? Which is a valid concern. And the answer to that is the driver only sees any information about tip after they have rated you as a rider. So these are kept separate, and there should be no impact between tip and star rating. And then another fun fact on that point too, is tipping might be less common than you think. So when looking across all Uber trips, it's actually something like 90% of Uber trips do not have a tip, just with the regular Uber app. So definitely it's not a requirement or expectation. It's just an option.
And Lisa, I think that kind of goes, sorry to jump in with Catherine Seminelli's question about through the app ensuring that these funds are only used for non-medical transportation. You can't do like Uber Eats. And that's correct. It will only show up for transportation. So you can't use your waiver funds for Uber Eats or other things like that, which is pretty cool.
Thank you. That's important. So it's just about Christmas time. And if I had an Uber account, would a family member be able to give me Uber funds for Christmas to load my account or give me a gift card or something like that?
It's a really generous gift. But yes, you could buy an Uber gift card and use that as a payment method. That would be in the regular Uber app. So instead of a credit card as your payment method, you could use a gift card. But that would be limited to the regular Uber app as opposed to services that are covered by your waiver provider.
I got another question.
Go ahead, Roseanne.
The other drivers, like the other Medicaid drivers that got left behind because they didn't have enough drivers, do they have enough drivers?
Yeah, it's a good question. So that map, we can definitely make sure, Lisa, you have the map if you don't already, and we're happy to share that with this whole group. But the map will show you where you're going to have the best success in getting an Uber driver versus where you might have more of a challenge. And there are certain areas, especially in the northern part of the state, where you might have more difficulty matching with an Uber driver.
Right.
I was just gonna say, yeah, hopefully as Uber continues to grow, we'll see that improve. And yeah, maybe we can get some more Uber drivers within the New Hampshire community to keep growing the network.
Are there Uber drivers that have wheelchair accessible vehicles?
Also a good question. Thank you for raising that. We do not have a wheelchair adapted vehicle program in New Hampshire at this point in time. Not to say that it won't ever be available, but we do have a wheelchair program in some states, in really like the top 15 most urban areas of the United States. And so we have a very limited offering of that in other states. And we're looking to see how we can make this more available in more areas. If you have a folding wheelchair or another assistive device, the driver is supposed to help you put that device into the vehicle. But right now, we would consider Uber being the best for people who can get into the Uber on their own and get out of the Uber on their own.
All right. So I don't see anyone else raising their hand. I do have one more question. As a parent, I have a youth who has to go to a lot of therapies, and sometimes his dad's on the other end. Would I be able to put him into an Uber and send him along by himself?
Yeah. Yeah, you could do that actually, Lisa, with the kind of the demo that I showed at the first part of this. You can basically add in your son as one of the people in your family circle, and you can book a ride for him and send him to that destination. Yeah.
No, even if he's only 14 years old?
Oh, good question. Okay, yeah, 14, it's like a little bit more challenging. Yeah. So with Uber, it's 18 and older is really the population that is appropriate for Uber. But with that being said, there is an Uber teen program. Jump in, Patrick, if you know this. I feel like it's age 13 to 17 that it covers, and maybe through Uber Teen that actually could be an option. Although I'm
Yeah,
not the expert on the teen
yeah,
piece.
the Uber Teen product, it is, I'd have to check to see if it is actually available within New Hampshire today. I know that they, of course, have been opening up that newer product very thoughtfully. So we can loop back around on that side. But the Uber Teen has, enhanced security. It's recording inside the vehicle, doing a lot of other things that, of course, are, wrapped around that newer product for transporting teens. So we'll have to get back to you on whether that's available, and then we'll also provide some additional details on it as well.
Okay,
Yeah.
great. So I don't see any other hands, and I'm going to move away from the closing survey slide and wrap us up. In the aftermath, then we can have some of the presenters just hang around and answer more informal questions if you want to stick with us. Our next Lunch and Learn is going to be on January 16th. We're going to be talking about assistive technologies for transportation. A UNH employee from Institute on Disability, Stacy Driscoll, is going to be presenting for us, and Lindsay's going to be on hand to talk about how assistive technologies could be purchased through waivers. I want to remind you all that this presentation was brought to you by ABLE New Hampshire. It is a nonprofit organization that depends on membership and donations. And without those donations and memberships, we can't do all of the good work that we want to do. We have Creighton in the background here. She is an employee of ABLE, and we'd like to keep her. And lastly, I just want to thank everybody for